Hi, and welcome back this week where we are going to talk about all things what to expect before, after surgery. Now, again, these are general recommendations or education. This is not medical advice, but we are here to give you more information before your appointment to not only set your mind at ease, but also empower you with knowledge so that you can make the best decisions for you and really go into your appointments with good questions that can really help you kind of make very impactful decisions that align with your goals. So, today we are going to talk about what to expect before surgery. So, breast cancer surgery in general is on the spectrum of surgeries, one of the lower risk surgeries. So, compared to like an orthopedic surgery, an abdominal surgery, a vascular surgery, anything like that, breast cancer surgery is on the surface of the body. So, it's very well tolerated, and the breasts are really kind of extensions of our skin. So the pain level is much less than something like an orthopedic surgery or abdominal surgery. But all things considered, there's still, a surgery happening, but pain overall is usually much lower than those other types of operations. Now, most people need about 1 to 2 weeks to recover from a lumpectomy with a sentinel lymph node biopsy. That's usually all it takes for a recovery. There's, of course, different situations, or if someone has an infection or maybe some healing problems, that could be longer. But in general, the most common scenario is that most people are pretty back to baseline in about 2 weeks. Now, are they ready to run a marathon or do some crazy hit workout? No, they are probably going to have to take off from that for 4 to 6 weeks. But in general, they should kind of be able to do kind of typical activities of daily living. So like taking a shower, going on walks, unloading the dishwasher, cleaning, whatever it is in your life you do that's active, you should be able to get back to that in about 2 weeks, give or take. Now, mastectomy is a much longer recovery. It's a much bigger surgery. And if there's implants being placed or something like that, the recovery is more to like 4 to 6 weeks before you're getting back to kind of your activities of daily living. It's just a bigger surgery, bigger recovery. Now, with any surgery, there are three main risks. So there's risk of infection, risk of bleeding, and risk to surrounding structures. Now, in something like a lumpectomy, the risk of infection really only comes from your skin. We all have bacteria on our skin. And, most places will have you clean with a soap beforehand to kind of kill a lot of that bacteria. And then we give you a dose of antibiotics before surgery. And then we also clean the area before we do surgery with some kind of skin disinfectant, basically. And so that's how we try and minimize the bacteria. But it's not like a surgery through the oral cavity or GI tract where there is a lot more bacteria. So the risk of infection is lower, but that can definitely be elevated by things like diabetes, obesity. All of those things do add to a higher risk of infection or problems in the postoperative period. Now, I also do want to mention if anyone is taking GLP-1, like the Ozempic or Mounjaro, anything like that, those can cause delayed stomach emptying, which can put you at risk during surgery. So if you're taking any of those medications, just be sure to let your surgeon know so that they can have you hold it accordingly to the anesthesia preferences so that you have a lower chance of aspirating. That means, vomiting basically while you're asleep, which can be very dangerous and even life threatening. So, if you're on any of those medications, those typically need to be held. Blood thinners, those also should be discussed with the doctor that's giving you those so that they can guide you on taking those or not taking those. And then you have to discuss, any supplements that you're taking with your healthcare provider too, because some of those can also lead to an increased risk of bleeding at the time of surgery. So those are things that you definitely should ask your surgeon about, that I'm sure they'll already talk to you about, but just so that you can go in and knowing those are going to be discussed. there's going to likely be multiple appointments for you before the surgery. So, and multiple scheduling of things. So, like we talked about in our other video of all the types of breast surgery, you can kind of gauge that there's a lot that goes into breast surgery. On average, there's 12 people that come in contact with a breast cancer patient from the time they come into the office until they get to surgery. And a lot of breast cancer we can't feel or see. And when the surgeon's in the operating room, they're truly blind from the breast cancer. And how they can find it is typically with the help of radiology. And they can do this with either wireless devices or wired devices. It depends. It's up to the surgeon. They make different choices for different devices for different situations. But you are likely, unless you're getting, a bigger procedure or your tumor is very palpable, likely you're going to have some kind of localization appointment. This either happens the morning of the surgery, the night before the surgery, a couple weeks before the surgery, or in the operating room itself. Every surgeon does it a little bit differently and based on what resources they have available. So I would plan on having some kind of appointment that's involved in the localization of the tumor. Sadly, there's a lot of biopsies that happen that don't require resection. So most of the time, the clips that the radiologists are placing at the time of your core needle biopsy are not enough for the surgeon to find it at the time of surgery. So that's just something to know, is you will likely have an appointment to get some kind of localization done for the surgery so that the surgeon has eyes of where to go and where to resect so that they can do a localized targeted resection and leave the normal breast tissue alone. That's our goal for you if you're getting breast conservation, is to preserve as much breast tissue as possible, but at the same time giving you the safest cancer operation as well. So that'll be one appointment, is getting a tissue localizer. And like I said, that's either wireless or wired. There's multiple types of these available at all places. The second thing, and at my current hospital, we have the Magseed. That's what we use, or wires. That's what currently in my practice, what we have available. Now, the second thing that you're going to have to schedule is the sentinel node injection. And again, when I talked about this in the surgery video, basically we have to map the pathway from the breast to the first draining lymph node. And how that's done is an injection into the breast. And in my current practice, we use technetium 99. In other practices, they use other, and we're actually starting to use what's called Magtrace. That's another option for this. And again, it's the surgeon makes a decision on why they use different things in different ways. Some other people use different blue dyes. Everyone has different things available in their communities that they use, but a lot of people use at least 2 different ones of them to get the highest chance of getting the accurate node. So you're gonna also need an appointment for an injection prior to the surgery. In my practice, they do the injection at the same time as they're doing the clip placement or the wire placement. They give the injection at the same time, or I'll do it in the operating room as well. So those are the 2 appointments that will likely be happening before your surgery as well, so that you can kind of understand those appointments. Now, the other question that I get all the time is, what can I do as the patient before surgery? So you really want to be as well rested as possible. Of course, right? You have this huge life-changing, stressful event. So I'm telling you to rest, but I get it. Anxiety is probably at an all-time high, but things like working out, weightlifting, eating good, nourishing, fueling foods. I'm not talking about sugar. I'm not talking about processed foods. I mean, really good food, lots of fruits and veggies, lots of clean protein, lots of one ingredient foods, those are going to fuel you to help you recover fast after surgery, or faster than if you're fueling yourself with ice cream and candy and sugar and all those, and soda and all those addicting things that don't actually fuel us. They just are so addictive. It's hard, to let go of them at times. So I'm not saying that you need to reach perfection. You absolutely don't. But just try and get at least protein in your meals, some fruits and veggies, and some kind of carbohydrate or starches or something like that in your meals. That's what I tell all my patients is I want you to be as strong as possible before this surgery so that you can bounce back really quickly and move on through everything. And the healthier you are, the better you're going to be able to do that after surgery. And also, doing those things reduces your chance of anything coming back in the future. Obesity is directly linked to risk of breast cancer recurrence. So the lower that can be, the better. Also, muscle building, hugely helpful for also reducing your risks, and also minimizing alcohol or anything like that also helps reduce your risk of recurrence. So that's what I tell patients to do before surgery. Now, after surgery, depending on what operation you're getting, your life might look a little different. If you're having a simple lumpectomy and sentinel lymph node biopsy, you're definitely going to be walking the next day. You should be moving around. Do you want to be doing a deep clean of your house at that time? Absolutely not. Do you want to be going on a 5-mile bike ride? Absolutely not. You need to really give yourself a rest from any vigorous cardio for about 4 to 6 weeks, but you can do your Pilates, your low impact stuff starting really at 2 weeks if you can tolerate it. Also, you need to stay out of swimming pools, I live by the ocean. So away from the ocean, no cold plunges, no hot tubs, nothing, because you can get an infection and you need to do that for about 6 weeks after surgery as well. And again, these are just my post-operative practices. And that's what I tell patients. Now, a mastectomy, like I said before, you're going to have more of like a 4 to 6 week recovery before you're going to be doing things like Pilates or low impact exercise. But you should always be walking, especially after the surgery. You want to be walking every day, moving around every day. It's just you have to take it easy on a lot of the more vigorous activities in your life when you have a mastectomy. Pain shouldn't be too terrible, like I said, compared to an orthopedic surgery or a abdominal surgery. It's definitely a lower pain operation. You're still getting cuts though, and especially in a mastectomy, you can definitely have more pain in those situations, but it's overall less. So most people are just taking Tylenol for the pain. Some people require narcotics, but the majority, I would say, do not. And it's a pretty quick return to baseline compared to other surgeries, but it's of course a surgery. So you want to take it seriously and take off the time that you need. So that's what I would say. Oh, and the last thing, the lymph node surgery. So that one is the annoying, painful one. So there's all these nerves that travel from our neck down from our spinal cord down our neck through our armpit, called the brachial plexus. And a lot of these nerves have to be cut to get to the lymph nodes to remove them. So the armpit is typically the most painful incision of all the breast surgeries, and that can last for around 2 weeks, but usually it can linger a little longer just because it's a nerve pain, and those typically heal and take a little longer to go away. Also, another very common thing after an armpit surgery is to get what's called a seroma. So that's where you just get a little fluid collection in the armpit that can also be painful, and that can usually be drained by your radiologist or your surgeon after surgery to help improve that pain. It can come back in the future, but overall, your body will eventually absorb it in most situations. And we have other things we can use when it's kind of a longer term seroma. But those are the typical things to expect after surgery and before surgery. And thank you so much for joining me, and we'll see you next time.